Okay, good morning and welcome everyone. Thank you so much for being here with us today for part one of a two-part basic training on rape crisis services for incarcerated survivors designed for California victim advocates. Today we're going to be looking at setting up rape crisis services for incarcerated survivors. And then in part two next week, we'll be looking at providing those same services that we're talking about today. This is designed to be a pretty interactive experience. If anyone has questions at any point during the course of the webinar, you can feel free to enter it here in the question pane of the control panel. Here on this slide, you'll see two images. The one on the left is what it looks like if you're logged on via a computer. And then the one on the right is for those who might be using their personal smartphone or iPad. So this is what it looks like, and this is how you can reach us. We'll be asking several questions over the course of the webinar, and you can also use this box to answer questions that we'll prompt you with. And if we don't stop immediately to address your question, it may mean that it's already going to be addressed that it's coming up, the answer's coming up in the presentation. We will also have a dedicated question period at the end of the webinar to take a look at anything that we weren't able to address during the presentation. And I am Matthew Van Winkle. I use he, him pronouns, and I'm a senior program officer with Just Detention International.
And good morning, everybody. I am Marcela Rojas Salas. I use she, her pronouns, and I'm a project coordinator with CalCASA. Welcome, everybody.
And Just Detention International, or JDI for short, is a health and human rights organization that seeks to end sexual abuse in all forms of detention. It's JDI's core belief that no matter what crime a person may have committed, rape is not a part of the penalty.
All right, hopefully everyone can hear me again. So this is Marcella with the California Coalition Against Sexual Assault, and we are committed to ending sexual violence through a multifaceted approach: prevention, intervention, education, research, advocacy, and public policy. CalCASA provides leadership, vision, and resources to rape crisis centers, individuals, and other entities committed to ending sexual violence. CalCASA envisions a world free from sexual violence. And now in its sixth year, the California Office of Emergency Services, CalOES, funded California Advancing PREA project, which allows CalCASA and JDI to partner in offering support and guidance to California rape crisis centers on how to build strong relationships with California Department of Corrections and Rehabilitation, otherwise known as CDCR, county jails, and juvenile facility staff. We provide guidance on how to create sustainable agreements and protocols for the provision of victim services to survivors. Early in the project, the California Advancing PREA team focused on fundamental culture change on both the corrections and the advocacy side. And now over time, rape crisis centers have put many MOUs in place between state, local, and youth facilities. And although much progress has been made, we understand that there continues to be a gap and challenges in the services available to survivors behind bars. And we'd love to hear which organizations you're coming from and who is actually doing work in detention. And I'll pass it back to Matthew.
Thank you, Marcella. This is a look at just what we're going to be handling today. We're going to begin with a discussion of some of the basics of incarceration in the United States, as well as the problem of sexual abuse and detention in this country. We're going to be looking at the Prison Rape Elimination Act, known as PREA for short. Just a very basic kind of introductory look at that and what it means for you all in your role as victim advocates. Then we're going to pivot and talk about how you as advocates and agencies who are dedicated to the healing of all people who have been harmed, no matter where they are housed, how you can go ahead and build relationships with corrections staff to be able to provide these services in detention settings. And we'll be looking at some of what you can do internally insofar as developing protocols, forms, and policies at your own agency to make sure that the services you provide are never excluding, inadvertently incarcerated survivors. And then we will talk about setting up basic rape crisis services for incarcerated survivors towards the end here. As always, we want to encourage you to take care of yourselves during today's presentation, to slow down, stretch, stand up, sip some water, take a break, coffee, whatever. We really do encourage you to do that. It's not just lip service to an idea. You are permitted to take care of yourself over the next couple hours while we're together. So thank you very much for doing that. All right, now let's begin kind of with a helicopter view of incarceration in the United States and the problem of sexual abuse of people who are in detention. So the United States incarcerates people at a higher rate than any other country in the world, and our criminal justice system holds almost 2.3 million people in detention. So who gets locked up and why? As you can see from this graphic, most people who are locked up are there for nonviolent offenses, such as drug or property crimes. And this is very important to think about, especially given how our society often paints everyone who is incarcerated as unpredictable, violent. And certainly sometimes when we're partnering with corrections, that can be the tint that they view things through, and they may try to pass on some of that fear to you. It's important to remember that the folks who are there by and large are not there for violent offenses. There are also huge racial disparities in terms of who is locked up in our detention facilities. Far more Black and brown people are incarcerated in this country than white. And this is a vital piece of information when we're thinking about the relationship between racism and mass incarceration. We also know that people who are incarcerated have incredibly high rates of trauma prior to incarceration. Many of the folks you're going to be working with have experienced child abuse, sexual assault, intimate partner violence, gang violence, as well as violence at the hands of police prior to being incarcerated. And that leaves behind trauma. We're also working frequently with folks who have experienced extreme poverty and who may have limited resources and tools inside to help themselves. We'll be going into the subject of trauma in detention in a webinar on November 17th, if you want to pencil that in now. Of course, we are going to be sending out a proper invitation as we get closer. Because this is such a deep topic, we wanted to give it its own dedicated training, the subject of trauma in detention. So according to an estimate by the Bureau of Justice Statistics, or BJS, which is where we get most of our data about the problem of sexual abuse behind bars, roughly 200,000 people are sexually abused in US prisons and jails each year. Please note that this figure represents the number of people, not the number of incidents, because many of these 200,000 people are subject to habitual ongoing abuse. It happens more than once. So 200,000 is a large number, but the instances is far larger. And what is detention? Well, When we're talking about detention, we're talking about a lot of different types of facilities that are run by different entities at different levels of government and jurisdictions. These can include state prisons, federal prisons, county jails, lockups, community confinement facilities, juvenile or immigration facilities. Who knows, does anyone know some of the differences between what we call a jail and what we call a prison? Sometimes these words get used a little bit interchangeably, but there are several differences, and it's important to know how they're different. Does anyone have any ideas or thoughts about that? Well, here at a glance, here are some key distinctions to keep in mind. And the reason we want to be so clear about this is that many of the California agencies on the call today, and certainly many who are involved with the California Advancing PREA project, have not only a state prison, but also a county jail in their jurisdiction. So they're going to be partnering with both agencies, and in order to be credible when they're talking to staff at each agency, you don't want to slip up and make that mistake, because it will perhaps paint you in their eyes as someone who just doesn't know, who is an expert in the area you want to work. So here are some key distinctions to be aware of that can help us message appropriately. In California, jails are run by a local sheriff's department, whereas the prison system is run either by the state government, California, the CDCR, the California Department of Corrections and Rehabilitation. We also have several federal prison sites and immigration sites here in California. Oversight for misconduct is handled differently at each. The prison system here in California, oversight is by the ombudsman. And the jails, it's all depending on kind of what they've arranged, but it would be local and not at the state level. Prisons hold people who have been convicted of a crime, whereas the majority of people in the jail system have not been convicted. This is partially why the length of the stay for someone is much shorter in the jail system than in the prison system. So people tend to be in jail for less than a year, but in prison they tend to be there for more than 1 year. And while the length of stay in a jail system tends to be short, unfortunately many people tend to re-enter frequently. Jails also have far less robust programming and ability for free movement among the inmate population, whereas a prison would have, like a large yard that folks can more or less move about freely, unless they were under some sort of more intense restriction. We understand that these days with COVID, there is a lot more restriction in movement. But jails also have much less programming available. They won't have the kind of large recreation space. So they are very different facilities, and their jails are kind of designed both in terms of what's offered to the people there, as well as their physical layout for short stays of less than a month. And the national average length of stay in a jail is 25 days. However, in California, we find that people on average spend a much longer time in the jail system. Sometimes they're there for years. And this is because in 2011, the United States Supreme Court ruled that due to immense overcrowding, California needed to reduce its prison population. In response to that, California passed AB 109 into law. And while that bill did reduce the number of people who went to state prison, that does not mean that those people are not incarcerated, because those people who would have gone to state prison are now being pushed into the jail system, or are being sentenced to serve their entire time at the county jail rather than at the prison. So this means that people are being stuck in systems and facilities that are not designed for long stays, and they're being stuck there for years. This is having a very, very bad effect on their overall mental health and safety. So we did want to make sure that we highlighted this, this fact for you all who are advocates going to be working in both prisons and jails in California. So your jail clients will have kind of this additional lens to consider. Now we're going to go ahead and share a video of Joe Booth telling his story. Joe is a member of JDI's Survivor Council. As Joe tells his story, pay attention to the language he uses, and pay attention to what he considers to have been the most helpful thing that happened after the ordeal he went through when staff failed to keep him safe from a perpetrator.
There are quite a few different officers that an inmate has to check in with. And all those people, they all referred to me by my number. That advocate asked me what my name was. Because I'm not a thing. Because I'm a person with a name. And the first thing I told her was, my name's Joe.
Joe was one of the first clients I had, and I was brand new, like sexual assault advocate. Most of my communication with incarcerated survivors was through letters, and I would read, these words, and the feelings that they were expressing weren't all that different than any other survivor that I had worked with. The self-blame, the shame, the fear, the trauma, all of that stuff just was very similar to everyone else that I had worked with. The big difference being that, their resources were so limited, and their ability to self-soothe and their ability to seek out appropriate support was almost nothing.
I went to a psychologist. And my plan is that no matter what, am I going back into that cell? The psych says, okay, we'll get you moved. So I leave the psych, and here come the cops. And he comes up to me and he tells me, he says, all right, let's go. I said, where are we going? He said, back to your cell. Put me in waist chains and put me back in the cell. Nobody would let me out. I was on top of my bed. I was on the top bunk. He grabbed my ankle and he pulled me off the bed and proceeded to rape me. And the second night he raped me, and the third, and the fourth. Getting in contact with Jessica saved my life.
Some of the things that I would hear in the letters was just a lot of feeling isolated. And, with survivors who weren't incarcerated, they could just pick up the phone and call. We had a 24-hour crisis line. They could call whenever they, felt like it. But with the incarcerated survivors, their access to that communication was so limited. And so there was something really powerful and tangible about getting a letter, and you could see how hard they wrote or what their handwriting looked like, and then being able to write back. It was kind of this opportunity to be very thoughtful in a way that I couldn't have been on the phone, like in an immediate crisis, I was able to really be very thoughtful in my responses.
Jessica was my advocate when I was assaulted. She was the person that said it wasn't my fault.
I meant it.
That was a turning point for me. As soon as she told me, I know you've been raped, I knew without a doubt, without in she could have never said another word to me. At that point, I knew that I hadn't done this. After the assault, I had been treated like a number. And she asked me my name and she touched my hand as a human being. And it really made a difference. My name is Joe.
So the dynamics of sexual abuse in detention exist on a continuum of violence, just as they do in the community, from sexual harassment to rape. But some dynamics of abuse are specific to detention settings. Things like protective pairing, gang abuse, and abusive searches. Does anyone have an idea as to what the term protective pairing might refer to? Does anyone have, would anyone like to take a guess about that? Yeah, the term protective pairing, that is a term that we use when we're talking about an inmate who is offering protection to another inmate in exchange for sex, in essence. This is something that happens when one inmate is or perceived to be more vulnerable or weaker, or does not have kind of stature, or is kind of newer to the facility. They can be taken under the wings, so to speak, of an abuser who then exploits that relationship. And this often morphs into what is actually sex trafficking. If that abuser should ever need to pay a debt to another inmate or a staff member, then they could offer the person supposedly under their protection to settle that debt. So sometimes protective pairing can appear to be consensual to people who are unfamiliar with abuse dynamics. But if we ask the question about any situation, would a person do this on the outside? That is sometimes a good way to tell if if this is an abusive or relationship. To kind of commit violence, perpetrators often use these, the offers of protection, or they can also use outright threats, coercion, extortion, medication or drugs, and of course, physical force. Although physical force is not often the preferred method because that leaves evidence that can be detected by staff. So let's have our first interactive poll of today. So with a true or false statement, the statement is, the vast majority of sexual abuse in detention is perpetrated by inmates. Is this true or is this false? The answer is false. Studies show that nearly equal rates of sexual abuse are perpetrated by staff as are by inmates. And when I say staff, I want to make sure that I'm clear that I'm not talking just about uniformed staff who carry weapons and have badges, but also administrative jail staff, people that work in the kitchens, mental health staff, volunteers, basically anyone who is working at the facility who gets to leave at the end of the day. We're going to consider staff here. Are folks at all surprised by this fact? Yeah, it can be a little surprising, and it can be a little bit uncomfortable to understand that some of the folks that we are, perhaps, not used to seeing as perpetrators, people who are in law enforcement roles, or people who are in roles such as a doctor or a therapist who might have a career based around the idea of healing others, could be perpetrating abuse. But this is what the BJS data has confirmed for us. And we do have one other poll question here. Another true or false statement. If an adult inmate agrees to have sex with a member of the facility staff, that is considered sex between consenting adults. Select one of the following, true or false. All right, let's see how we answered. All right, 20% of today's attendees agree that this is a true statement, that if an adult inmate agrees to have sex with a member of the facility staff, that is considered sex between consenting adults. 80% think that statement is false. And the answer is false. So that is a very important thing to kind of know and understand, that the power inequality between staff at the facility and prisoners makes consent to sex impossible. There is simply nothing like an equal relationship here. Staff have control over inmates' physical safety, as well as control their access to basic needs, their access to visits from family and phone calls, ability to contact those on the outside. Staff has influence over the programming that someone will receive, their work assignment, and very importantly to consider and remember, also has access over their disciplinary record and parole date. I think it's also kind of very important to remember the fact that in any kind of dispute or disagreement between staff and someone who is incarcerated, there would be an overwhelming bias to believe the staff person's word over that of the inmate. And again, that's part of why that's part of what the PREA law was created to address, and we'll be going into a little bit more of that later. So which groups of people do you think are the most likely to be targeted for sexual abuse? Which groups do you think are most likely to be targeted for sexual abuse? Yeah, the answer is that LGBTQ folks, as well as survivors of previous abuse, are perceived as the most vulnerable folks being targeted for sexual abuse in detention. We know this because of that Bureau of Justice Statistics data. Of course, other groups who are at risk are folks who are youthful in adult facilities, people who are suffering from mental illness, people with disabilities. And I think part of the reason is that perpetrators look for folks who are less likely, who are going to be seen as less credible, less likely to be believed. That's one of the reasons that folks with mental illness are often targeted. And then, of course, LGBTQ folks are often seen as, kind of hypersexualized and always seeking sex, and that is, of course, a terrible stereotype, but that can be exploited by a perpetrator as well. But yeah, the two biggest factors that put folks at risk are having an LGBTQ identity or being a survivor of previous abuse. So we talked a little bit earlier about how we need to consider jails and prisons as being different, but there are some ways in which we can look at them as being similar. First of all, people of color, people with mental health challenges, and people who are trans are overrepresented in both jails and prisons, as well as being at higher risk of abuse. Another thing they have in common is that the presence of rape crisis centers in the facilities can make these facilities safer, as advocates share their expertise in providing trauma-informed care to make these environments safer for both inmates and staff. And jails and prisons are both mandated to adhere to the same set of PREA standards. PREA makes no distinguish between adult jails and adult prisons. There are different standards for immigration facilities, and there are different standards for youth facilities, but standard adult jails and prisons in this country all adhere to the same set of PREA standards, which we will be going into a little bit shortly. These are the words of Cecilia, a trans woman and a member of JDI's Survivor Council. Cecilia says, "Although you may think that I'm not like you, we may not be so different. I want to have control over my own body and my life, just as you do. I absolutely did not want to have sex with that man in the jail, but I felt powerless to refuse him." Now we'll talk briefly about the Prison Rape Elimination Act, or PREA, which of course is the basis for our project, California Advancing PREA. PREA is a civil law that requires corrections facilities take concrete steps to protect inmates from sexual abuse, whether that is perpetrated by staff or by inmates. PREA requires that facilities adopt a zero tolerance approach to sexual abuse. And the PREA standards affirm that it's the absolute responsibility of corrections agencies to protect the inmates in their custody from sexual abuse. At the same time, the standards recognize the importance of victim advocates from outside agencies in supporting those efforts. So it is corrections agencies that must comply, and corrections agencies are required to partner with agencies like yours to make sure that victim services can be provided to all inside. So at the most basic level, PREA's purpose is to eliminate sexual abuse in corrections and law enforcement facilities, to increase the accountability of corrections agencies. One of the methods is by the requiring of an audit process. Every facility is audited every 3 years to make sure that they're in compliance, to make sure they have an MOU with agencies like yours. We also see that a goal of PREA is to give incarcerated survivors the same level of care available to those who are in the community, and to provide corrections staff with clear guidance on how best to prevent, detect, and respond to sexual abuse and sexual harassment in detention. So, as I mentioned, there are more than 50 individual PREA standards, and they're all intended to do that prevention, detection, and response to sexual abuse. They do this by requiring that both through use of a screening tool and based on who reports abuse, to keep possible perpetrators as separate as possible from survivors and those who are most at risk of abuse. PREA requires that facilities provide survivors multiple ways to report abuse that they have experienced, as well as giving survivors access to appropriate emergency and ongoing medical and mental health care. and providing access to rape crisis services that are available, just as they're available to anyone in the outside community. So regarding reporting, sorry, I just see a question here. Is the audit optional or is it mandatory over 3 years? That's a great question. It is 100% mandatory. That is how that's how a corrections agency, it's part of how they stay in compliance, is by having an auditor come and take a look at their practices and their facility, conducting a lot of interviews with staff and inmates alike, and kind of taking a test read of how well PREA has been implemented there and how safe inmates feel. So yes, that does happen every 3 years. And most often, you can actually find those PREA audits online. They're, at least for the state and federal facilities. The county facilities sometimes choose to post their PREA audit, if it was a positive one, on their sheriff's department website. Most often you won't find the county audits online. Hope that was a okay answer to that question. But yes, regarding reporting, facilities have to provide survivors inside multiple ways of reporting sexual abuse. This is because someone who is a prisoner is so often constrained and under such kind of constant surveillance and oversight from staff. So if they're being abused by a staff member, it's no good if the facility only permits reports to be accepted from staff. There needs to be other ways around so that someone who is being habitually abused can actually signal that they're being harmed, can get the word out, can start the process of an investigation and hopefully a safer situation for them. So they must be able to report in writing, either through the formal grievance process or even an informal note under the door. It can be anonymous. They don't need to include their name. It can simply give a location as to where more oversight is needed. They must be able to report to outside third parties, for example, a loved one like their grandmother or spouse, or their lawyer or their pastor. And they must be able to report to an outside oversight organization. For CDCR facilities, as many of you know, this is the Office of the Inspector General, the PREA ombudsperson, whose phone number is posted throughout the California state facilities. County facilities are all responsible for setting up their own outside reporting organization to fulfill this requirement. In Los Angeles, they accept third-party reports via the Crime Stoppers organization. It's important. It's very important to know who this organization is for each of the facilities you're working with. And it's also important that it not be your agency. Rape crisis centers should not agree, and neither would a PREA auditor find it at all appropriate that you were listed as the third-party reporting agency for sexual abuse. This is because PREA defines the role of the victim advocate as one of providing confidential emotional support to folks who are in detention who have suffered sexual abuse either while incarcerated or at any point prior in their life. They need to be able to have that confidential channel, whether it's in writing, whether it's a hotline call, whether it is, although this is very rare these days, whether it's a routine meeting with a weekly advocate who has kind of a weekly office hours at the facility. That needs to be something that's protected. So rape crisis advocates should never agree to be the third-party reporting agency or to carry reports on behalf of the client. You can encourage your clients who are incarcerated who want to report to use one of the other methods available to them, but you should not be in the position of making a report. Although I should also say that if you would report it in the community, such as becoming aware of elder abuse, child abuse, or imminent harm to self or others, that you would need to report. But in terms of someone's emotional support and their story, as a survivor of abuse, that is not something that should be passed along. PREA also requires that any inmate who reports being sexually abused must be provided with timely and unimpeded access to emergency medical treatment, crisis intervention services, and ongoing medical and mental health care. So the standards mandate that this is also on the shoulders of the facility. They have to provide this at no cost, and they do not need to provide information about the perpetrator or make a formal report or anything like that. They need to, they don't need to, they will have, sorry, I misspoke. They will, at this point, they will have reported so that they can get this care, but they do not need to necessarily cooperate with the investigation if they make the judgment that that is not going to be the decision that keeps them the most safe. But they're still entitled to this care. I hope that's clear. And prisons and jails must provide everyone who's inside with access to victim services. These include accompaniment from an advocate at any forensic exams that are necessary, as well as at any investigatory interviews. This is often a piece that kind of gets lost because facilities are often disinclined to invite an advocate in when they're doing fact-finding and gathering, but it is so crucial for a survivor to feel that support of just having someone in the room for them while they're being asked questions by staff. That is their right under PREA. They are also required to facilitate confidential follow-up services by phone, by letter, or to request services by phone or letter, and that everyone must have that kind of access. Because of the importance of these kind of services being offered to those who have been sexually harmed, PREA requires that prisons and jails enter into formal agreements with centers like yours, MOUs, memorandums of understanding, which we'll talk a little bit more now. A memorandum of understanding between your agency and your correctional department should lay out all the services that the jail or prison will facilitate and that you will provide. At a minimum, this is the basic floor, we want to make sure that those MOUs include forensic exam accompaniment, telephone access, and written correspondence. Now, CDCR, we're very happy to say, has taken a very good approach to, at least at the leadership level, each facility may vary, but CDCR's statewide PREA coordinator has pledged that hotline calls made from inmate phones to the local rape crisis center will be toll-free, non-recorded, confidential calls, and they won't be monitored. And that written correspondence to the local rape crisis center will also be treated confidentially when the evidentiary code is written on the envelope. So it can definitely be a long process to enter into an MOU with your local facilities. I'm sure that many of you on the call are already aware of that. I know that when the project began, it took us well over a year to get that first round of MOUs in place between rape crisis centers and their local CDCR sites. And now the project has been opened up to include the local county jails as well, which of course has even less of a less centrality to it, because each sheriff's department is its own jurisdiction. So it can be a lengthy and complex process to enter into an MOU. But how that conversation goes, how that negotiation goes, how that conversation is carried out is an opportunity to demonstrate professionalism, respect, and consistency to those at the facility. It's a really good way to kind of show yourself off as being a reliable partner who can help keep their facility in compliance and the people in their care safer and with access to the care that they need. So let's have a little bit of a quick quiz game. The first question is, who must be in compliance with the PREA standards? You can select one of the following answers: rape crisis centers, corrections agencies, the United States Department of Justice, or all of the above. Most folks answered all of the above. No one answered rape crisis centers. No one answered the US Department of Justice. Very good at avoiding those. The correct answer is corrections agencies and only corrections agencies. The Department of Justice, drafted the standards, helped draft the standards. Rape crisis centers are mentioned in the standards as agencies that corrections departments must partner with, but corrections agencies alone hold the responsibility for being in compliance with the PREA standards. Next question. Do advocates have to report sexual abuse in detention? And you can choose one of the three available answers: no, never, yes, always, or use the same confidentiality standards as in the community. 46% answered use the same confidentiality standards as in the community, and that is the correct answer. Absolutely. Well, as we said, you should not be sharing a survivor's story that's told in confidence to you, and you should not be accepting reports. But if you become aware of things that, such as child abuse, elder abuse, or harm to self or others, you would use that standard for confidentiality. You would have to share those things if your agency has that policy. Next question. Do the PREA standards cover abuse that happened prior to incarceration? You can choose yes, PREA applies to incidents of previous abuse, yes, but only if the client did not commit a violent crime, or no, only abuse that occurred in detention is covered. Well, everyone who answered chose the correct answer, so congratulations. PREA applies to incidents of previous abuse that someone who's in detention may have experienced as a child or at any time prior to incarceration. So very good work there. Just to review, who must be in compliance with the PREA standards? Corrections agencies, not rape crisis centers. Advocates follow the same confidentiality standards as in the community. Yes, PREA applies to prior incidents of abuse. And yes, PREA also applies to sexual harassment. So, an effective, sustainable sexual abuse services program for incarcerated survivors depends on strong relationships between corrections staff and advocates. Developing a clear and robust MOU is crucial to this relationship, but it's only part of the equation. In this section, we'll lay out some of the challenges inherent to building such a partnership and cover some best practices when it comes to overcoming those challenges. So here are two truths, two things we know. First, partnering with staff at jails and prisons can be hard. It can be difficult, demoralizing, sometimes even intimidating. But there are survivors inside those facilities who need our help. So we need to focus on what we can control. This is what you can control just as an agency coming to work, and you don't need any cooperation or even an email back to do these things. You can make a communications plan for your facilities and you can stick to it. This can be as easy as setting up a recurring reminder on your phone or calendar to do it once every 2 weeks or once a month. You're going to be making outreach to the facility via email or by phone. And you're going to want to document those outreach efforts and change up the tactics when necessary. If you find that Sergeant so-and-so is more responsive to a phone call, then use that. If you find that they prefer another method, or that just stay nimble, have a plan, but hold it lightly, as we say. And also at your agency, you should keep abuse in detention as a living topic, developing protocols and trainings that are appropriate, that make sure that your services are always keeping an eye on everyone who might approach your agency needing help, not just those who are in the community. Marcella will go into this a little bit later with protocols. But also make sure that your intake forms are appropriate for all survivors. Do your intake forms include things such as an institution name, or a booking number, or inmate ID number? Making sure that your basic forms are all kind of in agreement and are adequate to intake of all possible clients for your agency is very important. And just kind of a fun little exercise in taking a look at CDCR hierarchy. All organizations are going to have some sort of structure. Your Rape Crisis Center may not have such a militarized structure as this, but this is how it can look, with the associate director up at the top, followed by the warden, all the way down to cadets, or being, kind of still in their training. Typically, your PREA compliance manager at a facility is going to be, for CDCR anyway, would be anyone between a captain or an associate warden. And oftentimes that PREA compliance manager would be one kind of in name only, where they would hold the position, but the actual carrying out of some of those duties would be designated to a captain or a lieutenant. And here's a little look at a typical county sheriff's hierarchy. This is for Riverside County, where we see the sheriff at the top, sort of a militarized structure. And your PREA compliance manager for for a sheriff's department is usually a captain or a lieutenant. All that information should be publicly available for your own county. You should be able to find that. So working with corrections requires strategic thinking and balance around accountability and building relationships, all while prioritizing survivors' needs. Staff at California prisons and county jails have their own priorities, such as enforcing rules to maintain safety and security, supervising prisoners, and responding to emergencies. And when you factor in the current pandemic, which is ravaging detention facilities nationwide, with hotspots and Californias like San Quentin, it becomes clear that corrections staff work in fraught, stressful environments, and that maintaining a semblance of control to them can sometimes seem more urgent than partnering with a new organization like yours if they're not familiar with you or your services. So they typically don't begin these conversations. As many of you are aware, it usually takes the Rape Crisis Center coming to them, and it can be crickets when it comes to outreach from corrections facilities. That is, unless there is an audit coming up, in which case you might suddenly be on the receiving end of some very frantic and urgent sounding emails and phone calls if they need to get an MOU established pronto. So every Rape Crisis Center and every facility are different, and there's no one way to build a relationship with the staff at any given detention facility. But there are some recommended best practices that can help you. You want to make sure that you're as familiar as possible with the facility before you reach out, and have some idea as to the problems they face. Obviously, there is thankfully increasingly news coverage of the problems being faced by prisoners and correction systems. So it's good to kind of stay aware, do a quick search and see, type in your local facility name and see if there are recent news stories about it. They could be positive, they could be negative, but it's good to just kind of have some background. What's going on there? Have there been any high-level staff resignations lately? Any bad stories about bad staff getting busted or smuggling in contraband? You want to be able to frame your services as supporting the facility's goals of safety and security, as well as being kind of a necessary prerequisite for passing a PREA audit and for having compliance. You want to take a tour and meet with both staff and the folks who are held inside. That is very crucial. If your relationship is only with the staff and they're your only window into the culture of the facility, you're not going to be able to message appropriately about your services. You're not going to be able to, you probably won't find many clients. But we find that when rape crisis centers take the extra step of meeting with folks who are held inside to really talk about the culture and the needs and what sort of language to use when talking about services. I guess just to use a very at-hand example, if your agency has, if the name of your agency has the word woman in it or youth in it, and you're coming into an adult men's facility, you might have some pushback, or people might not be as inclined to seek those services. Likewise, if your agency has the word rape in it, that can sometimes be a red flag. And depending, again, this all depends on the culture, which is why it's good to get in there and talk to folks and see how you should be messaging. Do you want to use an acronym where it's an R rather than the word rape printed? Would that help kind of folks feel safe approaching or reaching out? And you want to make sure you can identify allies among the staff and maintain that contact with that person. And I think I mentioned already that the PREA compliance manager is, a good place to start. But oftentimes they do designate some of those duties to someone who is slightly below themselves in the hierarchy. So we want, at the end of the day, there to be kind of a healthy rapport and contact between your agency and not only one or two people at the facility, but kind of a multidisciplinary approach where you are aware of, the names and roles of mental health staff. Maybe you have a connection to the facility's leadership, the associate warden or the warden themselves. You have kind of a 360 view of kind of how things work, the interlocking pieces, custody staff, mental health, medical staff. And we want that to kind of turn into, over time, that will kind of build up as long as you can show up and be consistent in your understanding of your own role, your ability to educate the staff who may be unfamiliar about your role and what you're there to do, what you're not there to do. And kind of over time, you'll build up that rapport. Rapport does not mean getting to a place of unprofessional friendship where the correction staff are able to kind of whisper in your ear about the crime that someone may have committed, where they're able to kind of try to place fear in an advocate who works with your agency through gossip or but what we mean by rapport is that you have established your agency as a source of expertise and a way to kind of increase the overall safety of the facility, that your feedback would be and ideas would be sought out. So once you've identified some allies, you want to be able to talk with them and frame well what you're really offering. As I've mentioned several times already, providing access to your services to the inmates held at the facilities is going to help these facilities pass their audits, and that your services and having kind of a trauma-informed presence of services available there is going to ultimately make the jobs of those working in the prison or jail easier, because folks who are hurting hurt. And we know that when someone is able to begin their healing and feel like they're not just an isolated island of a traumatized person, less likely to cause what the facility might see as issues or rule breaking or testing or challenging behavior, because they're receiving care that humanizes them, allows them to process through that trauma in a healthy way. So I've actually seen in many cases, overall, the culture and climate of a facility improves once access to rape crisis services is made available. That's now I'll turn it over to Marcella for a little bit.
Thanks so much, Matthew. I hope everyone can hear me again. So I want to focus on maintaining relationships, especially right now that we have some challenges with the pandemic in order to meet with folks on the inside. So really developing a sustainable relationship requires regular contact via email and phone, and when there isn't a pandemic, in-person meetings. Maybe in the place of in-person meetings, you'll be able to meet over Zoom. And this should really extend beyond the PCM to different staff at each facility, and this may take some time. You can also invite detention staff to upcoming RCC events, during which you may want to ensure that the rest of your RCC staff get to know the detention staff as well, to help understand the culture of detention and to create a wider net of relationships that includes the rest of your agency. And also so that the rest of your agency feels comfortable interacting with detention staff in the event that they begin to go into the detention center, or maybe other advocates start to get trained to respond to survivor letters or start to answer calls from survivors in detention. Oftentimes, if you're working a hotline, you may get a call from an incarcerated survivor. And if there's an opportunity to cross-train each other's staff, you'll definitely want to be aware of language that facility staff may use that doesn't necessarily align with your agency's mission and vision. And you may even want to allow staff time to debrief after their presentations. These are the presentations that are being led by detention staff. And really, this would be a space for your staff to only be present and to be able to discuss any challenges or gaps in their learning that could be addressed. And again, setting up and maintaining a healthy relationship with the facility really allows us to facilitate stronger services for survivors that you're serving. And part of this healthy relationship also entails providing detention staff education around trauma-informed care, your role as a victim advocate, and the services that you provide. And because facility staff also experience high turnover rates like we often do in our field, this may mean that you'll be constantly setting boundaries with them and reminding staff of your role as a confidential advocate. So one way that you can continue to maintain those relationships is to request a tour for advocates at your agency, especially if you have a new advocate, or if you're adding another advocate to your PREA team, to go ahead and go on a facility tour and really be able to see the leadership in your agency around incarcerated survivors and building up your victim services program. And it's really a benefit to your agency also to have tours recur twice or maybe once a year, as again, your advocates are being rehired, or you're adding more folks to your PREA team. And this is really so that advocates have a sense of what the facility's layout is and who the people are that are staffed there. So just a really short list of what you should bring, since most of you know that you can't bring very much into these facilities. So, you're always going to want to bring your state issued ID. You'll want to make sure that you know what the dress code is prior to entering the facility. And usually their staff are pretty good about letting you know what their dress code is. Oftentimes it's that you can't wear certain colors, you can't wear open-toed shoes, and always encourage to wear comfortable walking shoes, because you will be usually walking around the facility and getting to know the layout of that facility. You likely won't be able to bring your cell phone or your computer, so we certainly encourage folks to bring a notebook and a pen if that's something that they do allow you to bring in, so that you can write notes, write a to-do list, anything that you're learning while you're at the facility, you can write down in your notebook. We absolutely encourage folks to bring your business cards and your outreach materials that describe your services, so that you're sharing this with many of the folks that work in that facility, not just the PCM. And then you can go ahead and also not just have the PCM share those materials for you, but be able to share them yourselves, so that folks can kind of make a connection between you and your agency. So here are some things that you might want to request to see as you're going on this facility tour. So certainly you'll want to be able to see the housing units where many of your clients are being held. You'll want to see administrative segregation. Oftentimes, folks that experience sexual assaults are put in administrative segregation for quote unquote protection. And you'll want to see what that looks like, because oftentimes it's not the most comfortable space to be in. You'll also want to see the intake area, and you'll want to ask about private locations for in-person services. Even if that's something that you're not providing quite just yet, you'll want to be able to see what that location looks like. And so you get a better sense of what you're working with. You'll also want to take a look at the medical and mental health areas. Perhaps you'll be able to meet some of the staff that are there, and you can share your outreach materials with them. And something to keep an eye out for is for those PREA postings, including those which provide your own agency's information. Oftentimes there will be PREA postings that don't include your agency information, and I'll talk a little bit more about what to do to get your agency specific advertising available within that facility. And then last but not least, you'll want to check out the detainee telephone areas. Especially if you're answering hotline calls, you'll want to know where folks are answering calls, and really be aware of the lack of privacy and confidentiality that folks are experiencing when they're making their calls to your hotline. And Matthew mentioned that you'll want to be meeting with not just the PREA compliance manager and the PREA coordinator, but if you can, certainly advocate to meet with the investigative services unit lieutenant, the mental health staff and the medical staff. It may be that you only schedule about 5 minutes to meet with them, but at the very least, you'll be able to make that warm connection with them. And last but not least, we certainly encourage folks that are working in state facilities or CDCR facilities to meet with their inmate advisory council. Sometimes this is called the MAC for short, or the Men's Advisory Council, or WAC for short, the Women's Advisory Council. And so this is sort of a student council, or a governmental association within that facility, within that CDCR facility, of folks that are incarcerated that really understand the culture of the facility. These are folks that you can ask to share your outreach materials with. You can get feedback on your outreach materials. As Matthew mentioned, you'll need to be a little bit strategic about outreach materials that you create for folks that are in detention, so that it really is something that people feel comfortable and trust in reaching out to your services. And so this is a great resource and connection to be making. Of course, it's a little bit more challenging to connect with this council right now due to the pandemic, but this could be a point of conversation when you're talking to the facility staff that, hey, I know that there's an inmate advisory council. We'd love to be able to connect with them once we're able to re-enter the facility safely. And of course, what to ask. There's many questions that you can ask, that you can put on your agenda when you're meeting with folks. But one of the very first things you'll want to do if you're just starting to set up your relationship with the facility is to ask who are your points of contact while you're in the facility. Likely it'll be the PREA coordinator, but if the PREA coordinator isn't present at that time, you should likely need to ask, are there other points of contact that you could communicate with when you're entering the facility, or you need some type of support? As I mentioned earlier, you might want to ask, is there a space where I can meet with survivors in private? And what do I need to know about facility safety procedures while inside? That will likely be something that you also learn about as you're getting clearance and then take a volunteer training at that facility. You may also want to know what programming is offered at each facility that you're going to, and how do your clients access it. This might be something that you want to share with your clients as a resource, and it might also just be knowledge to keep at the back of your mind as you start to think about when you want to schedule your one-on-ones with folks, or when you want to schedule support groups. You can also ask if you can make a test phone call to your agency from the detainee phones. This might be something that you do on a monthly basis just to make sure that the phone call is going through to your hotline, and that it is going through without any issues with collect calls, or that no one's monitoring the phones. Even if you have set this up already, it's good to just do this once a month, because things sort of slip up sometimes, and sometimes the PREA coordinator will need to call their telephone company just to make sure that everything is running smoothly. And last but not least, it's always helpful to schedule a follow-up or implementation meeting at the very end of your meeting, instead of sort of reaching out to folks via email afterwards and trying to nail down a date and a time. It's good to be able to do that at the end of your meeting. And something that we on the team, we love to say is have a plan and hold it lightly. It's always nice to have ideas in place on what your services could look like, but like we do with a lot of our work in the community, it's important to hold our plans lightly. We can offer suggestions on how things could work, but always remember to also solicit ideas from the corrections staff and the PCM and remind them that this really is a partnership. While you all are really the experts on victim services and survivor-centered work, we also want to make sure that they feel like they're being included, and that they have that their feedback is also being taken into consideration. And also the staff will know details such as what time would work best for the facility in terms of setting one-on-ones or support groups that you may not be aware of. And it can also be helpful to get feedback from different levels of staff and not just upper level management. So for example, you can ask the person at the entrance what you can do to make getting into the facility easier, to make this run a lot more smoothly. We hear from advocates that, you know, oftentimes they're not let in. And so that might be a conversation to have with the person at the entrance, or the folks that usually work at the entrance of the facility. It can also help to check in with mental health staff as well, so they know why you'll be in the facility and that you aren't duplicating services, but instead you're augmenting the services. Oftentimes we see that folks that work in mental health may be confused about your role, or see your role as the same as theirs. And so we want to make sure that it's very clear that your role is different from theirs. And so now, before we head off to a short 5-minute break, I want to make sure you're all aware that these resources exist. They're full of good ideas and best practices for forming good relationships with your facility staff. JDI and CalCASA both authored the Access for All, a guide to serving incarcerated survivors toolkit. And this toolkit was written primarily with advocates with California state prisons in their service area in mind, but the sections on building relationships should also apply to folks that have county jails in their service area. And we'll also go ahead and send a link to the toolkit and its sister toolkit, which is intended to educate correction staff about the role of victim advocates, in our follow-up email to this webinar. So now that we've discussed what it takes to build strong relationships with facility staff, we're going to go ahead and talk about what can be done to create good internal protocol at our respective rape crisis centers to serve incarcerated survivors. But before I start talking, I'd like folks to share in the questions panel what kind of internal protocol your RCC has created to serve incarcerated survivors. This could be including a spreadsheet to track your communication with facility staff or the services you've provided to incarcerated survivors. This could also be ways you've incorporated incarcerated survivors into your meetings or your intake forms. So I'd be curious to hear what some agencies have implemented and sort of collaborate with you to see if there's any ideas that other advocates haven't thought of. So certainly want to hear that from you in the questions pane. So I will actually let you all start inputting that in the chat, and I'll start reading as they come in, but I'm going to go ahead and move into our next slide and kind of keep an eye out in the questions pane for your responses. So, sometimes getting in the door in corrections is not only a challenge with the corrections facilities, but within our own agencies as well. It can be hard to focus on our work with incarcerated survivors when our agency often may not leave space for this work because we're so used to working with folks in the community. And one of the main things we can do to help sustain a solid PREA program is to make your PREA work a habit. And so some of these habits may look like keeping a schedule that the rest of your staff knows about, having regular weekly times where you contact folks at your correctional facilities to follow up about whether they've received any referrals, check in about the hotline calls. When there isn't a pandemic going on, trying to have at least monthly consistent times where you go in person to your correctional facilities is a great idea. And now that we're unable to enter these facilities, scheduling monthly calls is probably the next best thing. And so we want to make sure that they know that your services are still available and that you're still thinking about their facilities and that you're still thinking about survivors behind bars. Keeping these meetings and in contacts regular will help keep them sustainable, even if individual positions at your agency change and grow. And if you do have regular staff meetings, you want to make sure that there's a space for you to talk about your PREA program and services, even if it is very brief, even if it is just to say that there hasn't been many changes since your last staff meeting. Again, making your PREA work a habit at your agency can really help us make the space and have the energy to keep pushing to get in the door at your facilities. As we know, it can be oftentimes very frustrating if we're not seeing the results we want. So in addition to including time to talk about incarcerated survivors and your relationship with your facilities during staff meetings, it's important that you check in regularly with staff who are directly involved in working with incarcerated survivors. Most of your agencies may have a designated PREA advocate. This might be the person who holds the strongest relationship with your facilities, but you likely have other staff who answer hotline calls, respond to letters, and forensic exams for incarcerated survivors. And you may have management staff who provide guidance to you and your PREA program. And so it's super important that you have those team meetings in order to track any patterns of abuse that your PREA advocate can bring up to the facility, or maybe your staff are seeing a decrease in calls or letters from incarcerated survivors. And this might be a signal for the PREA advocate to check in with the PCM to ensure that the posters are still up, that the letters that they're sending out are being distributed properly to ensure confidentiality, and that hotline calls are remaining free, non-recorded, and confidential. We don't ever want to see a decrease in calls as a decrease in abuse or trauma in the facility. We want to kind of be able to figure out what might be the gaps in outreach, or maybe there's issues with the hotline. And as your relationship with the facility continues to strengthen, the services you're able to provide to survivors may expand to include in-person services or support groups, again, when there isn't a pandemic. So it's important that everyone on your team is clear on how to message these services, if they're responding to a letter or if they're responding to a hotline call or a forensic exam, so that they can explain to survivors how they can access them. And last but not least, folks answering the hotline may receive inappropriate calls from folks at the facility, as we often also see in the community. So if your agency hasn't already done so, it would be important to create protocol on how to respond to these calls and what to do if you continue to receive calls from the same person. So I wanted to go ahead and highlight some trainings for staff and volunteers, especially because CalOES now requires that our 40 and 60-hour volunteer training includes training on how to support incarcerated survivors. And so making sure that staff and volunteers are all trained in working with incarcerated survivors is vital so that everyone is prepared to work with someone who is incarcerated. This means anyone who answers hotline calls or responds to forensic exams should be trained on how to work with incarcerated survivors. And so this facilitator's guide, which is created by CalCASA and JDI, includes a PowerPoint and a script and a webinar that outlines how to facilitate this training. And this PowerPoint can be included in your volunteer or staff training. There's a place where you can add your own facility or facilities as well to sort of adapt it to your own agency. And we're also happy to connect with you to review your slides or any questions you may have that may come up during the training. But really, this is a way so that you don't have to start from scratch and you already have the slides ready and made for you. And this is also another toolkit that we'll be sending in our follow-up email after this webinar. And so if you haven't already, it's a great time to review your agency's policies to ensure that the language is inclusive of incarcerated survivors. As Matthew mentioned before, many, if not all of us, are unable to meet with survivors and facility staff in person. So it's a good time to look internally and to review and improve internal protocol. And as you're reviewing and improving this internal protocol, you certainly want to be sharing this with the facility staff so that they can provide input if it's relevant to their work. You can make changes to your intake forms if you haven't already. As Matthew mentioned, you'll want to have a space for you to check off that your survivor is incarcerated, where they are incarcerated, what their inmate number is, and whether they were assaulted or harassed by staff, another incarcerated person, or a person or partner prior to being detained. We'll talk a little bit more about what this can look like in our next September training next week on Tuesday, when we talk about providing services to incarcerated survivors. And then something else that RCCs have done is create a manual that outlines best practices for their PREA program. This manual is always subject to change as we learn and grow our understanding of the PREA standards, identify best practices for serving incarcerated survivors, and as we begin to expand the services that we're able to provide to survivors behind bars. And manuals like this really help when there's staff turnover and we want to make sure that the previous PREA advocates' work is not lost when they leave the organization. And so on the right, you'll see Coalition for Family Harmony's Sexual Assault Response Protocol for the Ventura Youth Facility, which is already finalized. And if this is something that you're interested in seeing and checking out, certainly email me or Matthew to get a copy of it. We also have Riverside Area Rape Crisis Center's PREA manual, which is in the works, in progress. And this is a guide to advocating for incarcerated survivors of sexual assault specific to their agency. And of course, if you're working on manuals, whether that's a manual on how to work with incarcerated survivors or a manual for sexual assault response protocol, certainly reach out to Matthew or myself. We're happy to provide feedback and another eye if you need any support with that. So for job descriptions, for victim advocates, we encourage folks to include language around serving incarcerated survivors, even if the job description isn't for the designated PREA advocate. Victim advocates who answer hotline calls and respond to forensic exams or letters will eventually provide support to incarcerated survivors. So it's important that this is highlighted in our job descriptions in the same way that we might highlight working with young survivors or LGBTQ survivors or male survivors. And as for the PREA advocate who often works closely with the facility, it's important that there's a line included around providing trainings, not just for RCC staff, but also for correctional staff. This could be, a completely different field to be educating and facilitating with. So we want to make sure that folks feel confident with that. And if you're not sure if language like this is included in job descriptions at your agency, it would be worth checking with your management team to ensure that it is. And so we're going to quickly move into setting up rape crisis services for incarcerated survivors. And a quick note on setting up services during the pandemic, because it is a weird time to start building relationships and setting up services with facilities that are close to outside volunteers. So many of you have been able to set up in-person services, now have had to rely on hotline calls or letter writing to communicate with your clients. And while this seems like a sort of a detriment to our work, I really want to emphasize that since these are the two only lines of communication, to continue to really build on it and make sure that folks are still utilizing it. And I also wanted to give folks just a kind of an overview of what I'm hearing from rape crisis centers in California. So advocates are noticing a decrease in calls because survivors are fearful of using phones because many do not know when the phones were last sanitized. We're also seeing a reduction in the incarcerated population due to releasing some of the folks that are immunocompromised or folks with low-level offenses. Okay, so I'm going to go to the next slide. I want to focus a little bit on forensic exams. I think it's important that we're communicating with facility staff about whether your agency is providing hospital accompaniment via phone or video. Some of you may be providing accompaniment in person. So as policy and protocol is updated to ensure the health and safety of your staff and your clients during forensic exam accompaniment, you'll want to make sure that you're communicating this with your facility. You'll also want to make sure that your facilities are not, that they are still conducting forensic exams instead of using the public health crisis as, an excuse not to transport survivors to hospitals. So if you haven't already, you'll want to ask your facility how they're ensuring the health and safety of staff and survivors when they must go to a hospital. Will survivors who went to a hospital be segregated from the rest of the incarcerated population when they return? And in general, it's important that facility staff are not overusing COVID-19 as an excuse to segregate and isolate survivors. So for folks that mentioned that only some of your facilities are offering confidential written correspondence, but are still working on getting buy-in from their facilities, these are some advocacy tips to take. So first, of course, you'll want to communicate the importance of confidentiality to facility staff. You can do this by explaining the importance of confidentiality when providing trauma-informed care to sexual assault survivors in the community. Something that JDI and CalCASA also created is a video that explains the role of a victim advocate that can be shared with correctional staff to either begin the conversation of confidentiality or to continue that conversation. And so once correctional staff and leadership are on board with ensuring that correspondence is confidential, you'll want to figure out how they're going to ensure that the letters are in fact confidential. So for example, at state prisons, victim advocates and their clients utilize evidence code 1035.4 and put this on the outside of the envelope as you see on this slide. And this really signals to mailroom staff that they are only to open this mail in the presence of the recipient. They are only to check for contraband and not to read the letter. And so if this practice hasn't been included in your MOU, you'll want to make sure that that MOU is updated. And so what kind of challenges might come up as you're advocating for confidential correspondence? As with setting up most confidential services in correctional facilities, there's often resistance with that. Correctional staff often fear that there will be contraband entering or leaving the facility through letters. Oftentimes, staff may be unfamiliar with how to handle confidential mail. And so just like with RCCs, correctional staff experience a lot of staff turnover. So it's important that the PREA compliance manager and coordinator and the mailroom staff continue to be knowledgeable about how confidential staff is managed in their facility. Sorry, confidential mail, not staff. And so what can you do to make sure that these letters are being treated as confidential at all times? You'll want to make sure that mailroom staff receive ongoing training on how to treat confidential mail to and from RCCs. If you find that your mail is not treated as confidential, you'll want to check in with the PCM regularly if there are issues. And so if you're wondering, okay, well, how do I know if mail has been opened or read? You'll want to continue to check in with your clients to make sure that their mail is is being opened in front of them. If they receive mail that's been opened or tampered with, let them know to inform you so that you can check in with the PREA coordinator about this issue. And again, with confidential calls, the first step is also going to be advocating for free, confidential, and unrecorded calls to your hotline. And so you'll need to explain why confidentiality is important for your role. You'll want to ask your PREA coordinator if the calls are in fact already free, unmonitored, and unrecorded. It's possible that the facility that you work with has already put this into place. And so making sure that your calls to your hotline are free, unmonitored, and unrecorded really is as simple as that facility calling their telephone company to make sure that their hotline number has all three of these in place. So some challenges and limitations that come up with these calls are that while the calls themselves can be confidential, the environment that they're calling from isn't entirely private. There may be other staff and incarcerated folks passing by while they make the call. It could also be that posters that provide information about your services and contact information are often being removed or repurposed. So because of that, it's important that you have established those monthly calls with your facility contact to ensure that one, your hotline continues to be confidential, unrecorded, and free, and two, that your posters are still posted near inmate phones. And as Matthew mentioned, the third-party reporting agency should be another agency outside of yourself, and there should be posters up in all facilities that have the direct reporting line someone can call to reach to make that PREA report. And these posters should also include information about their third-party reporting agency. For county jails, as Matthew mentioned, these jails aren't as centralized, so you'll want to check in with your PREA coordinator to ensure that they are not using your agency as their third-party reporting agency. As he mentioned, a confidential victim advocate needs to remain confidential, and it's important that you don't suddenly become the third-party reporting agency, as this can muddy the waters. And as I mentioned previously, with forensic exams, you'll want to communicate any updates during the pandemic to your PREA compliance manager, whether that's that you're providing accompaniment via phone or video conference. And even with the pandemic going on, the best practice will be to bookend the exam with a conversation with an advocate. If this is something that you haven't done already, you'll want to determine where the facility takes your clients for a sexual assault forensic exam. You'll also want to review the facility's coordinated response protocol and make sure that calling your RCC to notify you that a survivor will be undergoing a forensic exam is part of their response. In addition to making sure that the survivor is aware that a victim advocate is available for accompaniment. So we know that investigatory interview accompaniment via victim advocates is an important piece of advocacy that often goes missing, especially when working with incarcerated survivors. It's important that your RCC creates a communication plan between your facility when an investigatory interview is occurring. Facility staff should be trained to inform survivors that they do have a right to a victim advocate during their interview, and to call your RCC to accompany survivors during the interview. However, I do want to note that while sexual abuse investigations do require that a victim advocate is made available for survivors, sexual harassment investigations do not make the same requirement under the PREA standards. But as a survivor-centered and trauma-informed agency, we know that best practice would be to ensure that advocates be made available for both types of investigations. So this will require a lot of relationship building and training for the facility staff to get buy-in on this. And if they agree to this, they would end up exceeding the PREA standards during their PREA audit. So that's something to kind of share with them as well. And in the case that a victim advocate is not present during the investigation, it's important that facility staff provide the survivor with your RCC's materials and contact information so that you can reach out, so that they can reach out to you if they're interested in follow-up services. And if given permission to do so by the survivor, you may also reach out to them via letter correspondence for follow-up. Okay, y'all, we're running a little bit late, so I hope you're staying with me. So as far as the community coordinated response team, prisons, jails, and juvenile facilities are required to have this team. You'll want to ensure that your agency is invited to these meetings. This is really a space where you can offer your skills as a survivor-centered and trauma-informed practitioner to improve the facility's responses to sexual abuse and harassment every step of the way. This is where you can bring up issues with medical forensic exams, investigations, and ensure that survivors are receiving follow-up services, regardless of whether their report was substantiated or not. And although this is a place where you can talk about improving services, you will still need to remain confidential at all times unless your client has explicitly stated that you can reveal their name and experience within that space. Okay. And so part of shifting a facility's culture to be more open to expanding victim services within their facilities is creating opportunities for cross-training. So there may be moments when staff say something that isn't exactly in alignment with your mission. Maybe they say something racist or homophobic. And while this is incredibly frustrating, it's also an opportunity to suggest opportunities for cross-training. So some moments we've seen RCCs do this is through the facility's PREA training to other facility staff, as well as their volunteer training. So you'd be sharing information about your services with volunteers. And you can also just have a separate training during one of your monthly meetings. And so some of those topics that folks have trained facility staff on are dynamics of sexual victimization, trauma-informed care and confidentiality, the roles and services of rape crisis centers and issues faced by specific communities like LGBTI survivors, people with disabilities, and survivors of child sexual abuse. Okay, so setting up services, in-person services really quickly. The first step to setting up in-person services would be to get clearance from your facility to meet with folks who are incarcerated. When you're meeting with facility staff, you can ask them early on whether they have a private physical location where you can meet with your clients. Sometimes these are spaces where they meet with attorneys. And oftentimes in jails, there may be much more limited space and attorneys may have already had scheduled time in these spaces. So you want to make sure to coordinate with facility staff based on their availability. If your agency wants to take the approach of providing drop-in counseling once a week or month, as opposed to scheduling one-off sessions with a survivor, you'll want to identify a date that works with your facility and your clients. And so once you identify a date or a time for drop-in counseling, quote unquote, you'll want to figure out how to advertise this service. You'll ask yourself, will you make a poster that includes the date and time, your agency's contact information for survivors to call and make an appointment with you directly? Or will the survivor need to communicate this with the PCM at your facility? Likely it'll be that you'll be working with the PCM directly. And last but not least, advertising your services is a huge, huge part of making sure that your services are well known and well used within the facility you serve. You'll want to make sure that those posters are up with your agency's contact information and services provided over by the inmate phones and in other relevant common areas. And the importance of feedback from and word of mouth through the inmate advisory councils at your state prisons really can't be stressed enough. Once more people begin to utilize your services and receive the care that they had hoped for, you will likely begin to get more calls and letters. Your clients will be able to speak to the trust that they built with you and the support and services they received from your agency. And this is why it's really just so important that your responses to letters are meaningful and personalized to each letter, and that hotline responders are confident when providing emotional support and coping mechanisms and resources to incarcerated survivors. News really travels quickly in detention facilities. You can also set up time to talk to mental health staff, intake staff, and your PREA compliance manager about providing referrals to your services. Oftentimes, these are folks who must ask if incarcerated folks have experienced sexual abuse at any point in their lives. So these are opportunities for them to provide your materials in case these folks have experienced prior abuse to detention or ongoing abuse in detention. All right, so I just wanted to lastly end on a note to validate and affirm your skills and experiences as survivor-centered and trauma-informed practitioners and advocates. The services you provide to survivors behind bars are unique and critical for them to access. And so survivors behind bars really depend on your RCC's relationship and ability to build a very strong relationship with correctional facilities in order to access victim services that often result in healing and recovery. So we're just going to go ahead and end with reminding you all that we do have another webinar coming up next week that is more focused on providing rape crisis services to incarcerated survivors, which is going to be held next Tuesday at the same time. So we invite folks to join us to learn more. We do have some time for questions. I know we went over time, but if there's folks that are still here with us that have any questions, we are happy to stay on and respond to these questions. Alrighty, thank you so much, everybody. We appreciate you spending your morning with us. We'll see you next week.